you're the first joined by live. Thank you. Don't forget, tap as you come in. Tap, 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 tap. Tap, 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 tap. This is an evening chill vibe. This is an evening chill vibe. If I got the music, drop a comment. If I got it, I will play it. So it's a chill, relaxation Sunday. So get tapping and I'll try and see if I can find the music. If you drop it in the comments, I'll play it for you. I'll give you a shout out. Tap as you come in. Tap the live so I know you're here. Hi, Titi. Welcome. It's like a big boost looking for bigger than it is. Sorry, it's my lights. Every time I move, it comes on. Watch. I've got 4 of them. Look. Oh, my lights come on when I move. It's a sensor one. I don't want it on all the time, so I don't know if I know I've got my glasses on, but I'm going to have it on because I want to read who's coming into my live. Michelle Page, welcome. Nicola, welcome. Rahid, welcome. Please put a picture on your profile. I would really like to call everyone out. But I'll call this on your profile. I would really like to call everyone out. But I'll call this one. Roger Hampton, welcome. Cherie Williams, welcome. It's a chill Sunday evening vibe. It's a nice relaxation vibe. Something a bit different. Don't forget, double tap as you. It's a chill Sunday evening vibe. It's a nice relaxation vibe. Something a bit different. Don't forget, double tap as you come in. My husband and company knows I play. This is my hubby's gown. I like his gown. Chill Sunday. Nice, vibrant, relaxation. For me, I don't go back to work till Tuesday. But the ones that have to go back to work tomorrow, this is for you. Actually, it's for everybody on this live. Double tap as you come in, it's free. Double tap as you come in, it's free. So yeah, it's a chill Sunday. I'm not too sure what's on this playlist yet, so hello, excuse me, don't judge me. So I'm hoping on this playlist is why it's on this playlist. But every so often on this Apple phone, it just jumps and put in music that I didn't even put on there. Mate, when I'm driving the car, it's like I'm driving and the vibes are going. Girls, guys, you know what I'm talking about. You're just driving, you got that mellow going, good melody. Next minute you got some rock and roll sleeping in it. I didn't put no rock and roll on my phone, but I got rock and roll and I'm trying to cruise. And I'm like, okay. Do I forward it, let it play? Do I skip it? But yeah, so what comes next comes next. Don't judge me. Excuse me. And don't take my handle. That is my handle. Hello? That's my handle. Hello? Squeeze me. That's my handle. Hello? Yeah, anyway. All jokes aside, this is a nice, chilled Sunday vibe live. Yeah? You can double tap the live so I know you're still there. And just sit back, relax, and let the weekend roll through. And now, as on point, the music has stopped. Typical. Okay, let's see what else we got on here. Let's get the glasses going. Girls are nothing without big glasses. Okay, let's see what else we got on here. Let's get the glasses going. Girls are nothing without big glasses. Too soon. Too soon. Relax. Don't forget, double tap, double tap. This is a chill out, relax live. You know, just sit back, enjoy. Let me know you're there. I've got 96 people on this live. Keep tapping so I know you're there. Let the algorithm know that I am a real person. Honestly, I am a real person, even though I've got this crazy ass freaking medical problem. I am a human. I am a human. I'm a human being. I haven't been made in no laboratory. I am a human. So, double tap the live so I know you're there. So that they know you're there. They're not like us. But I am. What else we got in there? Welcome, Helen. Welcome, welcome. Okay. Who else we got? Lloyd. Welcome, Lloyd. Welcome, Sally96. Welcome, Naya. Welcome, Bart Sipperson. That caught me off guard then. Yeah, welcome Caroloid8. Welcome Selena Cuff. Welcome. Welcome Pamram1234. Welcome Mary. Welcome Charlie. Welcome Naya. Welcome Lillian. Welcome Rachelli. Welcome. Welcome Tina Barretts 255. Welcome Lorraine Johnson. Welcome Patricia Chickman. Welcome Lynn Howell. Welcome. Welcome Patricia Chickman. Welcome Lynn Howell. Welcome. Welcome, baby, you know, this is just a nice chill, yeah, it's just a nice chill Sunday, nice long weekend, and the meaning behind the weekend is like, it's heart-wrenching, but at the end of the day, you're here, we're gonna make the most, and yeah, just enjoy life, you never know, tomorrow might not even wake up, you know, so give thanks everything. This life is a life for life, you love, you know. So, I'm talking quietly because I'm outside in the garden. If I was indoors, I'd be But yeah, this is the chill. No club vibes in here. You ain't got like music pumping, screaming over the music. This is a nice mellow vibe. Get you in the mood, ready for those that has to go work on Monday. And those like me have to go work on Tuesday. Trust me, tomorrow's gonna go like that. So yeah, just sit back, relax, unwind, turn your phone up if you're watching on your phone. Turn your laptop if you're watching on your laptop. If you're like with me, got your phone connected to your hi-fi, turn that up. Relax. It's all chill vibes. It's all chillness coming over in here. Do you understand? So don't forget, as you come in, tap the live so I know you're there. It's free. It is, honestly, it's free. It's one finger and you go da da da. That's it. Yeah? Okay. I am gonna quickly go and grab what I'm gonna grab. I don't want that anyway. I'm back in 2 seconds. So when I come back, I am on right, okay. I have got 107 people watching. When I come back, there should be 107 people on this love and like. Yeah? Don't forget, double tap, love and like. I'll be back in a sec. Let's see. Okay. It's still on 0. But you know what? I don't care. Whether you like me or you don't like me, you know what? I don't give a damn. At the end of the day, you're going to still see this ugly face, which in God's eyes is a beautiful face, which is in my husband's eyes a beautiful face, and I will keep popping up on your stream. So, tap the live. That's it. Just tap it because it's free. Sometimes you've got to be a little bit stern. Or sometimes you've got to remind people, it's like they watch you and it's like, mate, yeah, you can watch me. You're watching me free. Yeah, to tap the live is also free. Just tap the live. That's it. Just tap so I know you're there. You know? But yeah, anyway. What's everyone doing besides watching me? I listen to my background sounds. None of these crazy records you got nowadays. Talking about your mother, your father, your brother, your sister, and who fought the dog, the rabbit, the mouse, and the kitty. You know? So yeah. Just drop it in the comments. Okay, let's see. Ooh. Okay, babies. Right, I've got a little goal, if you don't mind. Hey, babies. Right, I've got a little goal, if you don't mind. I've just pinned it on the live. If you'd like to tap that, I will be most grateful. It's 14.40 minutes left. Just double tap. That's it. That's if you feel free to. If you don't, that's fine. It's fine by me. But those that's come back onto this live from my earlier live, you know the reason why I'm doing these lives. This is on a serious note now. I'm doing it because I need to raise some funds to go and see a consultant who's in Germany. So yes, my live might not be as entertaining as you might want it to be. Hi Angelica21, welcome to my life. But at the end of the day, at least I'm doing something. Yeah, I'm not begging for nothing. I'm doing something like coming on live to do what I need to do to raise what I need to raise. Yeah. For those that don't know, should I disclose it? I'm not going to disclose it at the moment, but I will disclose it at a later date. But at the moment, all I'm saying is I need to raise some funds to go and see a consultant, a professional consultant in Germany. So that is the reason why I am trying to get as much lives out. Unfortunately, it can only be the weekend. If I've got time in between work in the week, I will try and do a little bit of live. It'll only be like 5, 10, 20 minutes, if that, because I'm really flat out at work. So the only time I get a chance to do my lives is at the weekend. A Saturday, Sunday, or Saturday or a Sunday. Hence the reason why I'm on live. So if you don't mind, if you like to support my page, it's for a good cause, which is me. I have been going through this medical issue now for, I was about 13 years old when it first started playing up, which is my arm. I'm sure if you watch my videos, you'll see my arm. I've either got the bandage on, or if I ain't got the bandage on. The main reason why I put the bandage on, 2 reasons. 1, to compress the pain, and 2, because I feel a bit embarrassed, which I shouldn't be, because it's no cause of my own. It's in my body, which is it's classed as a venous malfunction. Basically, for those who don't understand what that means, I didn't understand. Then my consultant said to me in London, the professor, he goes, "Oh, you've got venous malfunction." I thought, Venus? Mate, I ain't come from Mars. What are you telling me like I'm an alien? Venous malfunction? What the ass is thinking the venous malfunction? Basically, venous malfunction is... Right, it's to do with the veins, yeah? So all the blood supply around my body flows, not a problem. Some of the arteries on this arm, some of the veins, because that's what they thought it was originally. They thought it was to do with the arteries. It wasn't to do, and I kept saying to them, it's not the arteries, it's not, and I'm no doctor, and I'm telling the doctor, the consultant, it's not the arteries, it's something else. Because I can feel the blood trying to rush through, and then it stops, and then it rushes through, and that's when I get the pain. Every time it rushes through and stops, that's when I get the pain. Did you listen to me? No. So I was referred to Professor Stansfield. I don't know if he's still working as a doctor, but I was transferred to London under his care, and I went to see him, and then he goes, because they couldn't believe that I was in the pain I was, because they're looking at me. They goes, well, I'm looking at you, because like this, honest to God, all my life, yeah. If I'm lying, drop me down dead now, yeah, because I'm the sort of person, unlike whoever, all these other content creators, I tell the truth. I tell the truth. Look at my eyes. You see my eyes? Can you see my eyes? I'm a very truthful person. Maybe that's the reason why people don't like me, because I'm too truthful. I'm sorry. The only person I am afraid of is God himself. I ain't afraid of man. Anyway. So, back to Professor Stansfield. So I was referred from my hometown to the consultant in London. Waiting in the waiting room, and my whole hand, it was swelling. I think that's the reason why my hands are more wrinkly, because my hand used to swell, man, proper swell. It will swell up, then go down, then swell up, then go down. I think that's why I got more wrinkles. You see there, than there? It's because the hands is always swelling. Anyway, well, plus washing without gloves, hello. So, I'm there in the waiting room waiting to be seen by the doctor, the consultant, and then the consultant came out. No, sorry, first the nurse came out, took my details, what you're here for, Okay, a few minutes and then you'd be called by the consultant. Not a problem. I'm in the waiting room and I'm like this. If you see me now, do I look like I'm in pain? I don't. Yeah? But anyway, I was like this. Because I've got to a I had got to a point of where my pain threshold is quite high. But then when it goes past that barrier, it's like, I can't handle this no more. I can't. And I think that's the reason why sometimes in my face, obviously, you can see the lines of where I try to hide it sometimes from my husband. Yeah, and it's like, babes, you in pain? No, I'm okay. Babes, you're in pain. I'm fine. Babes, you're in pain. Yeah. And then he'll come over and oh my God, he will just rub my arm, just to comfort, to say, babes, I can't help you, but, oh, thank you so much, Jane Francis. Thank you for liking the live. Really appreciate it. Thank you very much, Jane Francis. And my husband, Paolo, I'll call him Pabs, but his name's Paolo. And he will come and he'll rub my arm and he goes, babes. And then he'll cuddle me and he goes, babes, I wish I can do something to make the pain go away. I wish I can take the back. Because, babes, trust me, when your 2 knees was bad. Thank you, Jane. Thank you so much, Jane Francis. Thank you for liking my live. Thank you so much. I go so happy. Do you remember when your knees was bad? I mean, my heart, when I said to you, the pain he had in his knees, and he will scream. It's like childbirth, screaming to push a baby out. That's the pain times 10. My husband's going, because his knee was bone to bone. And he understand the pain, because he went through the pain, and I was with him throughout, because you know what pisses me off with these doctors in the UK, yeah? I'm a born British woman. Let me rephrase that. Thank you, Jane Francis. Thank you again for liking the live. Right? You know what pisses me off with the UK doctors? They want people to come over to work, and my husband's been over here since 1999, and he's worked right through. I think it was only with the lockdown, obviously twice, times 2, that he didn't work. And then there was one time he was in between jobs and he was off for like a week, 2 weeks. Apart from that, my husband has always worked. So my husband's going down, but because they see the name is Portuguese, Spanish, my husband's half Portuguese, half Spanish, like obviously my surname. And I look at them and I'm thinking, boy, it's bad enough they treat me as a black person bad, but to treat a white person, he doesn't like to be called white, but hello, he's white. Yeah, he's not my colour, he's white. But he doesn't like to be called white because he's classed himself as blue blood. And it's like, hold on a minute. You can see my man, he's walking, oh my God. He's walking and his foot broke up. He's walking, and I look at it and I'm thinking, Lord God. So Lord, please, you gotta do something about this, man. You gotta do something. And me being me, anything to do with my family or people that I love, you see this milk here? God give me this milk for a reason. God put him with me for a reason. Because I do not play. I do not play with my family. As far as I'm concerned, talk about me as much as you like, because I can handle it. Talk. Give all your crap, your shape. Talk what you want to talk about me. But when it comes to my family, I will rip 10 shades into your ass, yeah? Because I be a Jim. I'm born in Britain. I'm English born, but my heritage is Barbadian, yeah? My bloodline is Barbadian and African, yeah? I got the African blood through my veins. I got the Bajan blood through my veins. I'm proud to be Bajan. I'm proud to be African. That's it. I ain't got nothing against no Africans because I am African. I might only be like 10, 15, 20%, but I am a proud African and I am a proud Bajan, not Jamaican, sorry, Bajan. And if I was Jamaican, I'd be proud of Jamaican as well. But I am a proud Bajan and I'm a proud African because that's the tool. When I went and got my blood done and my it was said about ancestry, you got to send it off and all this palaver. It came back 20% African. So I know I got African blood on me. I have an African backside. I have a Bajan backside, but I got English backside. So I've got that blood in me. So I am proud of my African heritage because it's in my blood. That's it. I can't deny it because as far as I'm concerned, I can't say, oh, I'm Bajan and, oh no, I'm Bajan and English. Oh no, I'm not African. Hello. So how did you get here? How did you get here? I'm sure you got here through the African road, which I call it. It's a road. It's a straight road. There's the wall. There's a straight road. And it's only one way you can go. So hello. As you go down that straight way, then it departs to different countries. I am African and I am proud to be African. I am Bajan. I am proud to be Bajan. I am British. I am British. That's it. That's it. I'm proud to be African. I'm proud to be Bajan. I am British. That's all I can say. I've only got the tone. Am I proud to be British? Look at my face. Like I said, I don't lie. I don't lie. I haven't said nothing, but I don't lie. Hello. Thank you, Jane Francis. Thank you so much. Oh my God. Thank you, love. Thank you so much. Do me a favor, people. Go onto Jane Francis' page and follow her, please. Go onto her page. Leave this live. Go onto her page. Tap 40 of her followers. 40 of her followers. Make sure you tap it. Yeah? You tap 40 of her followers. And then afterwards, come back and type done. Please, if you don't mind. Thank you. I'll be waiting. Whilst I'm waiting, I will continue. Anyway, so we managed to get my husband's knee sorted out because they didn't want to do nothing. They kept giving him these painkillers and more tablets. So goes, babes, no. You need to not be on these tablets. You seriously need to come off it. Anyway, that's my husband. So from rubbing the arm to me talking about my husband and his knee, he understands the pain. But because he doesn't get pain in his knee, in his mind he knows the pain threshold because he's been through pain, but he doesn't know the pain that goes through my arm, the level, but he knows it's bad. So he can always tell because, you see this is the telltale sign because I haul it. And I notice, I will say about the past 8 months now, I've noticed I've now got a deeper crease because I'm there holding it. I'm fine, babes, I'm fine. And I now got a deeper crease there and one's come up here. Yes, it's to do with old age, but I've noticed because I'm holding the pain more and not speaking it, that's the reason why. And you can always tell when I'm in pain because you just look at me. Babes, don't lie, because I'm not lying to you. You ask me, am I in pain? I will say yes, or I will say I'm okay. Because I don't want to worry him. Yeah, I don't want to worry him. And I see the way he looks at me, and it's like, I know he wants to do more, but his hands is tied. He don't know what to do. He's not a doctor. Yeah, he's a shuttering foreman carpenter. That's what he is. He's a carpenter. Yeah, and he doesn't know anything on the medical side. So if he can try and help me, he would. So the only way that he can help me is by rubbing the area that he feels that might soothe the pain. Anyway, fast forward. So I was in the living room, in the waiting area, waiting for Professor Stanford to come through. He's come in, and then he goes, his son looks at me. At the time, my previous name, but anyway. Angeline, yes. My name is Professor Stansmore. Nice to meet you. And I'm there like that. I'm rocking. I'm rocking and holding my arm. Okay, we're really busy today. Are you in pain? Yeah, I'm in pain. And he goes, from 0 to 10, how much pain are you in? He goes, 50. I'm in pain. Do you know, he looks at me, he goes, you don't look like you're in pain. But what we're going to do, we're going to get a monitor and we're going to put on your arm. 5-10 minutes. Okay, no problem. Like I said, I don't need to lie. So he strapped this monitor to my arm. And he goes, I'll be back in 10 minutes. Fair play to him, because he was flat out. Everyone had to go and see Professor Stansfield, because he don't play. He is one of the best. He was, I don't know if he's still doing it, but he was one of the best consultant professor in London to deal with pain and joints and problems and what have you. Thank you again, Jane Francis. Oh, bless her. Oh, bless you, darling. Bless you. May God bless you. May God bless you. May your basket never run dry. Thank you so much, Jane Francis. I know you're only tapping the live, but bless you. God bless you. You know, God bless you. Anyway, so he's put this monitor on my arm, and he goes, oh, thank you, darling. And then he goes, what I'll do, I'm going to come back in 10 minutes. I'm there rocking. I'm in pain. And I'm there, I'm shaking. I'm thinking, okay, Anne, calm down. Calm down. Just bring it down. Bring the pain down. Just try and bring it down to that borderline level that you can handle. And I'm there. I'm trying to bring it down. My body's shaking. I'm thinking, okay, bring it down, bring it down, bring it down. And I managed to get it on a level that I can handle. But I was even now, it's a habit now. You see me rocking. It's a habit. Yeah. So anyway, I'm gonna stop. When I catch myself rocking, I stop. But anyway. So then he come back in 10 minutes time. He looked at the monitor and he froze. He goes, Angeline. I goes, yeah. He goes, you are in extreme pain. I goes, hello? Of course I'm in friggin' pain. That's exactly what I said to him. Duh. Of course I'm in pain. I'm not going to come down and waste your time if I'm not in pain. I'm in pain. It's not the pain that comes and goes and that's it. Or you just get it once and it stops. Pain. It goes to me, the reading on this monitor is equivalent to you literally giving birth to a child. And times that by 10. And I stood back and I looked at him. I sat back in my chair. And I went, so do this face look like I'm in pain? He goes, no, you don't look like you're in pain. I goes, I'm in pain. I'm in pain. I'm in pain. So then he goes, right, come through. And then he goes, what we're going to do, we're going to perform an angiogram. Because we think that is to do with your arteries. Because I don't think it's my arteries. My arteries is not blocked. I know you're the doctor. I know you're the professional. But it's not my arteries. Thank you. Thank you so much, Francis. Thank you. I go, it's not my arteries. I got a feeling it might be my veins, but I'm not a doctor, but I know my body. I think it's to do with the veins. Anyway, I went into it's like a daybed unit. I went in there, he booked me in. I had to wait around for another hour. So he booked me in. He goes, right, what we're going to do, we're going to shave down there. I go, we're going to shave down there? It's my arm. How you think that this is no down there? That's my coochie. Wait, because I'm thinking, as soon as he said we're going to shave down there, I thought, what are you shaving down there for? Well, you want to see black cooch? Eh? Hello? And I goes, no. I goes, because it wasn't the consultant. Well, it was a consultant that said, we're going to get you prepped. So the quote unquote anaesthetist, he goes, right, what we're going to do, he goes, lay on the bed. I thought, oh, okay. Angiogram, I've never had an angiogram. So he gets lay on the bed. I thought, okay, stay there. I thought, good thing I had a good show before I come home. So he lay down. And he goes, what we're going to do, we're going to shake. I go, oh, sorry, you're going to what? I said, I've already shaved. Anyway, it's my arm. It's not there. It's not down there. Because I think, what are you going to cut you for? Well, my coochies are mapped to show you the reason why I'm getting a pain. Hello? You know what I mean? And he goes, oh, no, handling. What we're going to do, we are going to put a not catheter. Did he say catheter? Yeah, I think he said catheter. Anyway, the tube, the long tube, yeah? What we need to do, we need to shave you. This is in my brain. When he was speaking to me, in my brain and my ears, this is how it sounded. We're going to shave you. We're going to cut you. We're going to numb the area, obviously, that order. We're going to shave you. We're going to numb you. We're going to cut you and we're going to insert up into the arm and down to have a look through the arteries. And I'm thinking, mate, you better numb me good, because if you cut me and it hurt, I'm going to give you one drop kick. Right? Anyway, so he shaved it and then obviously numbed it. And he goes, can you feel that? I could feel the slight, like, it was like a tap, but not painful. He goes, right, and then he cut it. Didn't feel him cut it. And he took up this big long tube. I thought, where he going with that? And then he got the tube, and what it is on the end of the tube's got a camera. So he's pushed it up through the artery, then up. Keep it in mind, he was going through the arteries, not the veins. I don't know if you can get those sort of cameras at the veins, but anyway. So as he got up here, my hand started spasming. I thought, what's going on here? And he was trying to push, and I could feel him pushing it from down here, up, and it was getting. I goes, is it stuck? I goes, because my arm was spasming. I was in pain. Mate, the pain I had in the waiting room, it was 10 times more, and I was in pain 10 times more, because what was happening as he's got through and up, he couldn't curve it to then go down the arm to take the pictures and the footage of the arm, and my arm was spasming. And he goes, nope, sorry, handling, you got to take it back out. So right, and it's like, oh Lord, and the whole hand swelled up, and I was like this, Lord God, and I kept saying, God please, God please, God please, God please, God please. Anyway, he stitched up the incision he made, and then he sterilised it, put a little bandage over it, little plaster bandage, sterilised little clear bandage. And he goes, don't bathe for 24 hours because it's got to crystallise in the clothes, and then you can bathe as normal. And it was invisible stitches, so it dissolves, yeah? So then I thought, okay. So before I left, the consultant said, right, call me back in the office. I goes, okay. I goes, so what's the problem? He goes, well, from what we can see before your arm started spasming, it's not your arteries. We got a feeling it might be your veins. So what we're going to do, we're going to reschedule you to come back to see us, but it's going to be for surgery. And I looked at him, I goes, okay, but I did say to you, it wasn't the arteries, it was the veins. I had the feeling it was the veins. So he was the one that did this one. Yep. Now, before we're under, he goes, what we're going to do, Angeline, we are going to open up the whole arm, expose the arm, find the root of the problem, and then unfortunately you are going to have a big scar down your arm. Is that okay? I goes, love, I don't care. Try and get it as straight as possible. That's always the trip. Try and get it as straight as possible. Because in my mind, what I was going to do, if anything, if it looked bad, I was going to get a tattoo so it would hide it. But anyway, when I wake up, It's like he got half bit and maybe the thing went blood. And look how, that's not even straight. Yeah? He didn't see to this problem which he was supposed to see to. And then afterwards, I got a letter through the door about a month, 6 weeks later, saying, we have done the best we can. Oh, okay then, Jane, thank you so much. Bye. Thank you so much, honey. Thank you for your support. I really appreciate Jane Francis. Thank you so much. Yeah, have a good weekend. Have a good night's sleep. Okay, thank you so much, Jane. So yeah, roughly about a month, 6 weeks later, I got a letter through the door saying basically there's nothing they can do. But there is a place in Germany that can maybe, he said, see to your condition. Oh, saying it so it's like a freaking disease condition. So I goes, okay. So I called his secretary. So is it possible for me to speak to Professor Stansfield? So she goes, okay, we'll get him to call you back. With reference to the letter. So you just want to speak to him? Yeah, I just want to speak to him about something. So anyway, called him back and I goes, well, okay, you mentioned about this consultant or professor in Germany. How do I go about it on the NHS to actually go to Germany to get it done? And he goes to me, well, it's at the time it was £30,000 to get treatment in Germany. So that includes the flight, the hotel, the anaesthetist, the consultant fees, the before care and the aftercare. And I'll be there for about a week, 2 weeks. He goes, okay. So with the National Health, well, NHS, because I've paid my taxes, I've paid my national insurance. Oh no, NHS, when it pay, you got to foot the bill yourself. Hold on a minute. It's a medical problem. I need to get it done in Germany because you lot over here is incompetent to do it, as far as I'm concerned. You're the one that cut the first scar, then you went in again, and then you went the third time, and then you fucked up. You realise you fucked up, telling me that whole Germany now can do the work. I looked online and apparently there's a professor in Germany. I've got to try and get the name of him actually. And he actually do it, but it is 50 grand. It's a lot of money. I haven't got that sort of money. So hence the reason why I keep coming on live. I try to get as much reels out as possible, because at least if I'm on live, maybe I'll get some super thanks. Maybe if I get to the 10,000 mark and over, then TikTok will start paying me. The same as my Facebook, and the same as my YouTube. YouTube, I'm on... How much am I on YouTube? I'm on... Oh, can't remember. Right, YouTube, I am on... Let me see. Yeah, YouTube, I'm on 1.7k followers on there. Facebook, I've got two that I use on Facebook. I use the Zuri Chronicles, and the Zuri Chronicles I have, if I can find it. Oh God, where is it? Zuri Chronicles. Oh no, I need to do it. They keep changing the blimmin' thing. So, what would be under? Oh, right, Zuri Chronicles. Oh, where is it? How could I find? Would it be under profile? Because I've changed this blimmin' thing. So how can I find profile details? Because it'd be on the main of the page. Keep moving it around, trying to confuse me and tick me off. Because it used to be under where it says friends. Edit profile. No, it's not under that. Would it be on this? Profile status. How do I find on YouTube profile and taken? No, not that one. How can I find? Because it's not on the main. It used to be on the main bit of the page, but they've moved everything. So how can I see? Nope, not that one. Is it edit? No, not edit. How can I see? Follow settings. No. How can I need some help? How can I see? Welcome all. Welcome to my live. Welcome, welcome, welcome. How can I find where how many followers I've got on my YouTube? Not YouTube, Facebook. It used to show it on here, but no, it's not showing me nothing. Let me see. Showing everything else. Followers. Found it. That's how much followers I've got on my page. On my Zuri Chronicle page. It's 2,236 on the Facebook. But you know how much I get? How much Facebook pays me every month? 9 pence. Well, cents, because it's United States dollars. And I've got 2,236 followers on my Zuri Chronicle. On my main page, I have got on my main page, I have got, oh gosh, hang on, get off. Oh, get it back, get back. On my main page, I've got 869 on my Facebook. That's my Facebook page. You screenshot it if you'd like to come along and follow me on there. And I've also got another page. This is just my flyby page. It's Martellus Official TV. And I have on there 236. And I've been trying to incorporate all my pages, my 3 pages, into one. I thought I did it, but I'm still only getting 9 cents a month. 9 United States cents a month. So yeah, so my Martellus Official TV, I've got 236. That's me. That's my 3 pages. I got the other one, but I don't use it that much. So yeah. So I'm trying to keep all the page going at the same time. So I've got things going. It is hard, especially obviously round working and everything in the week. I can only drop little things now and again. So I do try, but my main focus is getting this arm sorted out. Because to go to bed like now, I'm fine, I'm not in pain because I've got the bandage on. Because I wear this all day. Sometimes I take it off, especially when I'm washing up. Got the bandage on, not a problem. I get a bath, I take it off, get a bath, I get into the bath, and then I can feel my arm just squeezing. And it's like, oh, okay. So I quickly get a bath, grease my skin, get into bed, watch a little bit of CSI, put the timer on, and then I take an ibuprofen. That's the only one that seems to let me sleep and take the pain away to a level of where I can sleep. But it only lasts like 2 to 4 hours. Sometimes push. If I'm really tired and I take it, then I'll go 4 hours. If just normal going to sleep, not extra tired, 2 hours. So then I get up, I think, okay, put the TV back on, and then hubby looks at me and it's like, I guess I'm fine. Honestly, babes, I'm fine. I'm just gonna watch a bit of TV, put the timer on, and I'll doze off. And then I'll put the timer on the TV, and then next week, I'll doze back off again, and then I'll get up another 3 hours later. So I don't get the full night's sleep, you know. But I get some sleep, of which before every hour I was getting up. But the medication was on before, the one I took myself off. Every hour, every hour, I would take the painkillers that they produced for me. They gave me cocodamol and naproxen. Yeah, so celebrate. Right, and I'll take the painkillers, and it's like literally every hour I'll be up. I'll doze off, and I'll be back up. I doze off, and I'll be back up. This is not doing me no good. I'm more tired when I take the medication. So I said, you know what? I'm going to come off it. I took myself off the medication. This is not doing me no good. I'm more tired when I take the medication. So I said, you know what? I'm going to come off it. I took myself off the medication. And I see the doctor. The doctor goes to me, is there anything else you can do? Because all this is doing, it's making me drowsy, but it's not taking the pain away. So then I find I'm waking up every hour because I'm in pain. I take it, it stimulates the pain, and then I'm back up again. I take it again. I said, I can't be taking all this medication. My job. I said, I'm assistant site manager now. I can't be taking this sort of medication and I'm gonna be drowsy. And if I have to go at height and I'm tired, I'm drowsy, I might fall down, you know? So he goes, the only other medication we can give you is morphine. I said, you know what? It's fine. I will deal with it. I will raise this money and I will go to Germany and I want to get this done, whatever means necessary. And that's what I've been trying to do. You know, I know my content is not like the others. It's not entertaining, like funny and whatever. But like I said, I'm just getting into it, and you will see more of me because I'm more of a stage. I'm stage fright at the moment, believe it or not. I've got the stage fright. Sometimes I rabbit, and other times I'm quiet. I will speak a bit and it's like, okay, what do I say next? Because I'm talking to camera, for goodness sake, you know? So, that's my goal. That is my goal. I really want to raise this money so that I can get my arm done. I really do. And I can feel it already here, because usually by now, I've had my bath, my body's settled down. And then I can feel it sort of kicking in, so. Anyway. I am going to go off live. Thank you so much, Jane Francis, for boosting my live. I am 2.6k in loves on the likes, the likes on the live. Hi, Nana Aku1. Welcome. Thank you so much, Jane Francis. Thank you for your support. I really appreciate you. I will double check and make sure that I follow you. You are a good soul. You are a good soul, you know, and I appreciate it. So I'm going to go off live because it's 25 to 10. I'm outside, so I don't want to disturb the neighbours. So I think the next live I'll do indoors because it's more quiet. I can just talk as well as someone outside, it echoes. So I'm going to turn the music off and I will speak to you on the next one. Wish me luck.